Karuna is the mini functional restoration program in a way, where they get some patient education, some guided exercises, and then some guided audio sessions that help to calm the central nervous system.
One of the big problems is that we're sort of at loose ends. There's been a big withdrawal from the use of opioids. They're very prominent over the past 20 years in terms of trying to use opioids to treat chronic pain. But it's really become clear over time that firstly, they don't really provide a good solution. And in addition to this, they have really led to an increasing amount of opioids in society that are sort of fueling an opioid epidemic in terms of a lot of people using them for illicit purposes and really overdosing. What we're really looking at now is we're moving back toward the other types of treatments, the more traditional conservative treatments. And these actually work extremely well in treating chronic pain, but one of the big problems is that a lot of patients are in significant pain and they're limited in their ability to be able to participate fully in a functional restoration program, to be able to do the exercises and the things that they need to do to actually get their body moving and to get better, to build muscle and stability.
Afternoons are usually the most painful for me a lot of times. First thing in the morning and afternoons, because I've been moving a lot. You need to try everything you can. And we're so used to having someone say, take a pill, here you go, here's another prescription. And I went through that for so long. I wish I'd have found this a long time before I got to the point I am now. I'm glad I did.
And that's what the beauty of the Karuna system is, that basically the Karuna technology utilizes a form essentially of biofeedback to allow people to increase their range of motion, to be able to get past the neurological obstacles that have been built up over time in terms of their fear of mobility and their inability to develop that type of neuroplasticity.
Across the board, I've had positive feedback. This allows for decreased pain, improved function. Patients start to gain a feeling of self-efficacy as they're not really just that their pain decreased, but that they're able to do more. Treatment, along with the effects that I've seen, has made me impressed.
And that's what the beauty of the Karuna system is, that basically the Karuna technology utilizes a form essentially of biofeedback to allow people to increase their range of motion, to be able to get past the neurological obstacles that have been built up over time in terms of their fear of mobility and their inability to develop that type of neuroplasticity.
And I know we are helping our patients to see, and they're able to live their lives with more function and quality of life. That's why they keep coming back to Karuna, and I totally recommend it for people to try, because I wish I would have been exposed to this a long time ago.
I think that this will allow people to get back to a real, meaningful existence more quickly and improve their productivity overall in a way that we haven't seen before with any other type of treatment for chronic pain.
So overall, my experience with Karuna has been very positive. My patients have improved. It's an excellent option for patients in chronic pain, and I plan to continue to recommend it in the future.
Learning how to make your brain work differently is amazing to me. It's like no one ever tells you that. They just say, here, mask it, do this. Taking pain meds isn't making me any better. And so for this, movement is making me better, where pain meds don't. So for me, I would recommend it highly. As I said, I want one at home. And I want to keep doing it.